A 22-year-old from Ohio wakes up in a rented house near the Florida coast. He doesn't fully remember agreeing to come here. We'll call him Jake, not his real name. But his story mirrors hundreds of federal cases just like it. He remembers a phone call. A stranger who sounded like he understood addiction from the inside offered a plane ticket, a place to stay, and free treatment. No cost to him at all. Palm trees. A fresh start. A guy named a recovery advocate met him at the airport with a smile and a bottle of water. What he doesn't know yet is the actual business model. His new insurance card is worth more to the people running this house than he is. Every night he stays here, someone bills his insurer for services that may or may not happen. Every urine sample he gives, and he'll give a lot of them, gets billed at a price that would embarrass a hospital. And if he stays sober, the money slows down. So somewhere in this house, sobriety is not actually the goal. For over a decade, a stretch of South Florida became the center of one of the strangest, cruelest insurance frauds in American history. A machine that used real addicts, real desperation, and a real national crisis to generate hundreds of millions of dollars, one relapse at a time. Patients weren't just failed by this system. In case after case, they died in it, while the people profiting from their addiction kept billing. This is the story of the Florida Shuffle. How patient brokers, crooked treatment centers, and drug testing labs turned the opioid epidemic into a business model. A stretch of Florida coastline earned two nicknames at once: the recovery capital of America and the overdose capital of America. Confirmed. This video is based on federal court records, Florida state investigation, DOJ press releases, and years of reporting on the addiction treatment industry. The central case discussed pleaded guilty. This actually happened, and it may still be happening. To understand this scheme, forget the marketing photos of Rehab, the beach, the yoga mats, the promise of healing. Understand the money first. Insurance plans are required to cover addiction treatment as an essential health benefit, often at rates close to those for cancer or heart disease. That's a genuinely good policy. It's also, to a certain kind of person, an enormous unlocked cash register. A single patient with decent private insurance can be billed for tens of thousands of dollars a month in treatment, therapy sessions, housing, and above all, drug testing. Multiply that by dozens of patients cycling through a facility, and a rehab isn't really a medical business anymore. It's closer to a casino, and the patient is the chip. It's worth understanding exactly how that unlocked cash register got built, because nobody designed it on purpose. In the early 2010s, two separate pieces of federal health policy collided by accident. The first required insurers to cover mental health and substance abuse treatment on par with physical illness. The second expanded who could get private insurance in the first place. Both changes were meant to make treatment more accessible, and in most of the country, that's exactly what they did. But in a handful of Florida counties, with a permissive state regulatory environment and weak licensing requirements for sober homes, the same policy created something closer to an unpoliced goldfield. The rules said insurers had to pay generously for addiction treatment. Almost nothing in Florida law said who was allowed to open a treatment center, or how closely regulators would check what happened inside. This created an entirely new occupation, one that didn't exist a generation ago. The patient broker, sometimes called a body broker. Their job has nothing to do with medicine. Their job is sale. They find people who are addicted, and they find people who have insurance. And if they can find someone who's both, that person becomes extremely valuable. Brokers trawled online addiction support forums, hung around outside needle exchanges and detox units, and paid other addicts a finder's fee for referrals. Once someone was hooked into the pipeline, brokers were paid a bounty by treatment centers for delivering a live body with a working insurance card, sometimes a few $1,000s a head. Some brokers offered a plane ticket out of state for Ohio, West Virginia, Kentucky, places hit hardest by the opioid crisis, with the promise of sunshine and a real shot at getting clean. Some offered something much darker: drugs to keep a patient sick enough to remain in need of treatment, or cash funded quietly by the very insurance dollars flowing through the patient's own name. The addict, in other words, was often paying for their own exploitation without knowing it. There was a geography to all of this, and it wasn't random. Delray Beach had genuinely been a hub for recovery culture since the 1980s. real 12-step meetings, a real sober community. That reputation was the raw material the fraud economy strip mined. New arrivals didn't know that sober home was a nearly meaningless, unlicensed label in Florida. They just knew Delray Beach was where you went to get clean. So when a broker mentioned the name, it sounded like the last legitimate word before the offer. And once a patient landed at a facility, the real engine of the fraud kicked in. Not therapy, but a small plastic cup. Drug testing is a legitimate, necessary part of addiction treatment. It tells doctors whether a patient is using, and it can save lives. In South Florida's shadow industry, it became something else entirely. The single most profitable product in the entire scheme. So lucrative that insiders had a nickname for it: liquid gold. Every few minutes, somewhere in Palm Beach County, another cup got logged. Another number climbed on a screen no patient ever saw. A basic urine test, the kind you'd get at a doctor's office, might cost a few dollars to process and get billed to insurance for a modest fee. But a confirmatory test, one run through a more sophisticated lab process, could be billed at anywhere from several hundred to several $1,000s per test. Some facilities tested patients not once a week, not even once a day, but multiple times a day, multiplied across dozens of patients. A single crooked sober home with its own in-house lab could generate more revenue from urine than most small businesses generate from actual products. So the incentive flipped upside down. A patient who stayed clean and left treatment was worth nothing further. A patient who relapsed again and again, needing readmission, retesting, rebilling, that patient was worth a fortune, for as long as the insurance held out, or the body did. Some facilities, according to prosecutors, actively encouraged relapse. Halfway houses with virtually no supervision. Staff who looked away. In the worst documented cases, patients were quietly given drugs by the very people who were supposed to be treating them, because a relapsing patient could be readmitted and rebuild all over again. Sobriety didn't just fail to make money. Sobriety was bad for business. Multiply this pattern across an entire regional industry, and you get a genuine hotspot. Delray Beach and the surrounding towns became so dense with sober homes and treatment centers that residents started calling the area the Rehab capital of America. As the fraud metastasized through the mid-2010s, that same stretch of coastline earned its darker twin title, the overdose capital of America. The two nicknames described the same streets, sometimes the same houses under different ownership, after a previous operator got shut down and simply reopened under a new name. Local paramedics responded to overdose calls at a rate that stunned even seasoned first responders. Some crews reporting they revived the same patients at the same addresses multiple times in a single year. Firefighters began keeping informal tallies. Local officials eventually pushed back hard enough that some cities passed ordinances limiting how many unlicensed sober homes could operate on a single residential block. Every industry-wide scheme eventually produces a case that federal prosecutors can actually put a name to. In South Florida's addiction treatment fraud, that name was Kenneth Chatman. Chatman ran a company operating under names including Whole Life Recovery and Reflections Treatment Center, presenting itself to the public as a legitimate path to sobriety. Behind that front, according to the Department of Justice, Chatman built a business that treated addicted patients as inventory. He recruited them through patient brokers, often flying them in from out of state, then billed their insurance for excessive and sometimes entirely fabricated drug testing and counseling. And prosecutors say he went further than fraud alone, subjecting some of the young women in his care to sex trafficking, exploiting the same vulnerability his business was supposedly designed to treat. The core mechanism prosecutors described was brutally simple: keep patients dependent, keep them testing, keep the insurance claims flowing. Patients who tried to leave were sometimes discouraged or manipulated into staying. Patients who relapsed weren't necessarily helped. They were, functionally, renewed inventory. In the middle of this operation, patients under Chatman's care died of overdoses, while the business kept running around them, kept billing insurance, kept accepting new arrivals from the airport. One night, it was almost Jake. Paramedics revived him with a dose of naloxone, and within the week he was checked into a different house under a different name. Reset, restocked, worth exactly as much as before. The estimated financial haul from Chatman's operation ran into the tens of millions of dollars in fraudulent insurance billing. It represented just one node in a much larger network. Investigators identified dozens of similar operations across South Florida, all running some version of the same playbook. In 2017, Chatman pleaded guilty to charges including patient brokering, healthcare fraud, and sex trafficking. He was sentenced to 27 years in federal prison, one of the harshest sentences handed down in the entire wave of addiction industry prosecutions. What makes the Chatman case useful isn't that he was uniquely evil. He wasn't unusual. He just got caught first and hit hardest. The mechanics prosecutors laid out in his case appeared with only minor variations in indictment after indictment across the following years. Some operators ran smaller versions of the same scheme out of a single rented house. Others built multi-site chains with their own in-house testing labs. The industry had converged on a business model almost independently. Except here, the product was a human relapse cycle. The scheme had a nickname of its own, coined by the people who watched it happen from the inside: the Florida Shuffle. A patient completes a round of expensive inpatient treatment, and insurance benefits for that level of care start to run low. Rather than stepping down into genuine long-term support, the patient is quietly discharged, sometimes engineered, deliberately, toward relapse, only to be picked up days or weeks later by a different broker, delivered to a different facility under a different name, and admitted all over again as a fresh insurance claim. The same person, cycling from center to center to center, each operator taking their cut, each relapse restarting the billing clock. For the facilities and the brokers, the shuffle was elegant. A single vulnerable person with good insurance could be worth hundreds of thousands of dollars over the span of a single bad year. For the patient, the shuffle was a trap disguised as help, a revolving door where every exit led to another version of the same room, another cup to fill, another form to sign, another chance to fail in a way that somebody else could profit from. Some patients figured out the pattern themselves, and there's a bleak irony in what a few of them did with that knowledge. They became brokers too. It was one of the only ways to keep the lights on and stay near a supply. Refer a friend, earn a fee, survive another week inside the system that was consuming them. Investigators described a kind of grim pyramid, where yesterday's patient became today's recruiter, extending the machine's reach into support groups, detox waiting rooms, and online forum. The fraud didn't just exploit addiction from the outside. In its later years, it learned to reproduce itself from within. Families back home, meanwhile, often had no idea what was actually happening. Parents who mortgaged homes or drained savings to get a child into treatment sometimes learned only much later that the world-class facility was a rented house with a revolving cast of residents. Some families received the worst possible update instead: a call informing them their child had died, inside a system that had been marketed to them as recovery. For years, the shuffle survived because the people who understood it best had the least power to stop it. Patients and families scattered across the country, each assuming their own bad experience was a single bad facility. What eventually broke the story open wasn't one federal raid. It was local journalism, insurance company data analysts, and a handful of insiders willing to talk. Reporters at Florida papers began comparing notes on lawsuits, obituaries, and licensing complaints, noticing the same handful of addresses and operators reappearing again and again under different business names. Meanwhile, private insurers started running their own internal fraud analytics and flagging facilities with statistically impossible testing volumes. A treatment center billing thousands of dollars a week per patient in lab work alone was, mathematically, either running a miracle clinic or running a scam. At the same time, grieving families started comparing stories online in the same recovery forums the brokers had once mined for victims. They began to realize their loss wasn't an isolated tragedy. Other parents in other states were describing eerily identical timelines. Some of those families became the loudest voices pushing state legislators to act, turning private grief into public testimony at hearings in Tallahassee. The scale of the fraud eventually became impossible to ignore. For the first time in years, The number on that screen stopped climbing quite so fast. Florida's insurance regulators, state prosecutors, and eventually federal investigators built task forces specifically aimed at the addiction treatment industry. In 2017, the Florida legislature moved to tighten patient brokering laws that had existed since the 1990s, but had barely been enforced. The new laws closed loopholes that let unlicensed sober homes operate with almost no oversight, and strengthened penalties for brokers and facilities caught trading patients for cash. At the federal level, Congress folded new anti-kickback provisions targeting the recovery industry specifically into opioid crisis legislation. Dozens of operators across South Florida were indicted in the years that followed Chatman's case. Some pleaded guilty. Some fought the charges. The state's Sober Home Task Force spent years working through a backlog of complaints that had piled up faster than investigators could process them. Some reforms went beyond criminal law. Certain cities passed zoning rules limiting the concentration of unlicensed recovery residences in residential neighborhoods. Florida created a voluntary certification program for sober homes, and licensed providers were eventually barred from referring patients to uncertified residences. Insurers tightened prior authorization requirements for high-cost drug testing, and some simply stopped paying the astronomical rates that had made urine more profitable than therapy. But here's the uncomfortable truth underneath the prosecutions. This scheme wasn't really one criminal genius exploiting a loophole. It was hundreds of ordinary business decisions, made by hundreds of separate operators, converging on the same conclusion: that almost nothing was stopping anyone from monetizing a captive, desperate, insured population. Convicting Kenneth Chatman closed one facility. It didn't touch the economics that made 1,000 versions of Kenneth Chatman profitable in the first place. It's worth sitting with what, exactly, this industry figured out how to sell. Legitimate addiction treatment is difficult, unglamorous, and genuinely life-saving work. And it exists. And it helps people every single day, including in South Florida. That's part of what made the fraud so effective. Didn't have to invent trust from nothing. It borrowed the credibility of an entire honest profession and wore it as a disguise. The palm trees were real. The plane tickets were real. For a moment, standing in the airport, the promise probably felt real too. But the actual product being sold to insurance companies wasn't recovery. It was relapse, packaged and rebilled as treatment, over and over, for as long as a human body and an insurance policy could hold out. The patients weren't customers in any meaningful sense. They were the raw material, sourced by brokers, processed through testing labs, and discarded the moment their coverage ran dry, or in the worst cases, the moment their bodies gave out first. The lesson here is not that treatment doesn't work, or that rehab is a scam. That conclusion would be exactly the wrong one. And it's the conclusion that kills people. The family who hesitates, the person who decides not to try again. Evidence-based addiction treatment saves lives every day, including on that same stretch of Florida coastline. The fraud worked precisely because real recovery is valuable enough to be worth counterfeiting. Somewhere between a few $100 million and over $1 billion moved through this shadow economy before enforcement caught up with even a fraction of it. Nobody has ever been able to put a final number on the people who didn't survive the shuffle. The ones who came to Florida chasing a fresh start their families had paid for and never got the chance to leave. As for Jake, he's 26 now, 2 years clean, working construction outside Cincinnati. He doesn't talk about Florida much, but he still keeps that old insurance card in a kitchen drawer, the one that was, for a while, worth more than he was. The system that was supposed to save them found a way to bill for their addiction instead. And in more places than anyone likes to admit, in one form or another, it still can.